Thank you. My name is Stacey Pogue. I am a senior policy analyst with the Center for Public Policy Priorities. I'm testifying in support of House Bill 565. Thank you very much, the chairman and the committee, for hearing this bill. I'm going to testify on the second half of the bill that talks about the market reforms and consumer protections for private health insurance, and specifically how that interacts with the Texas ACA lawsuit, Texas v. Azar, that seeks to invalidate the Affordable Care Act. That case risks upending a law that, while imperfect, has still been woven into the fabric of our healthcare system in a way that has resulted in millions of people gaining coverage and financial security over the last decade. Invalidating the ACA would mean 20 million people lose coverage nationwide. And here in Texas, too, lots of people would lose coverage even though we haven't acted on Medicaid expansion. We've had a historic drop in our uninsured rate with nearly 1 million fewer uninsured Texans. We just finished 2019 open enrollment for the Marketplace, where 1.1 million Texans selected a plan. And 90% of them get help. They get subsidies in the Marketplace using federal dollars only that connects them to coverage. And those subsidies are worth $4.9 billion a year, nearly $5 billion that comes into Texas that connects us with private health insurance that would be gone under that lawsuit. But there's a lot of things in this bill that would replace some of the things we lose with that lawsuit. But when we talk about ending Obamacare, a lot of people think about the health insurance marketplace. That's what comes to mind. It is certainly not limited to that. In fact, coverage, virtually all coverage that Americans have would be touched in some way by losing that law. So Texans with employer-sponsored insurance, that's 13 million of us, now have lifetime and annual, have lifetime and annual limits on our coverage. We have preventive care with no copays. Young adults can stay on their coverage till 26, so that both means kids can stay on their parents' coverage, but also foster kids who are youth aging out of foster care can stay on Medicaid for foster kids up until age 26. They have a parallel provision. And of course, there's no pre-existing condition exclusions. House Bill 565 addresses each of those provisions. There's also Medicare. 3 million Texans are in Medicare, and they now have preventive checkups with no copays. The donut hole, the gap in coverage for prescription drugs has been closed. So that lawsuit could mean that many seniors face higher prescription drug costs. And then, of course, Texans who buy on their own. And we have more than 1 million of those. They would lose the $5 billion a year in subsidies I talked about, and there'd be substantial loss of coverage. And, of course, then we'd lose our pre-existing condition protections. Yesterday, the Episcopal Health Foundation released a poll that shows Texans overwhelmingly support ending discrimination against pre-existing condition protections. 9 in 10 Texans support that, and that support cuts across party lines. Despite that, we have plans sold in Texas today, these skinny short-term plans that do discriminate against pre-existing conditions. Pre-existing conditions means high blood pressure, high cholesterol, mental health issues, asthma, right? Any condition you have that you know about today, and most of us have them or someone in our household does. So it's really important that our healthcare system works for people who have known healthcare issues. So I think this bill's important. I think it's important, especially in the context of this lawsuit, that we talk about, well, what would we be doing in Texas if we didn't have the ACA at the federal level that has these provisions that I just went through? Lifetime limits, preventive care, no pre-existing condition discrimination. They all have very broad support. And I think it's time to have a talk about how we would replace those in Texas if the ACA lawsuit was successful, and this bill's a really good starting point. So thank you in advance. Thank you for your time. I appreciate it.
Chair recognizes Chairman Turner.
Thank you, Mr. Chairman. Stacey, thanks for your testimony. Just to drill down on a couple of things. On the lawsuit that we're talking about that Attorney General Paxton brought, the state won that lawsuit at the district court level, right?
That's right.
But the court's ruling was stayed upon appeal. Do I have that correct? Okay. So if the, I think I've read a lot about, a lot of legal scholars think the ruling wasn't grounded in the law, but should the ruling be upheld and the state of Texas eventually wins that lawsuit, that would mean that absent us passing this bill this session, that Texans would no longer have protection against pre-existing condition discrimination. So if someone had high blood pressure, high cholesterol, diabetes, any number of other conditions, they could be denied health insurance. Is that right?
That's right. In our state law, people who buy insurance on their own can be turned down or charged more for pre-existing conditions. We've never brought those pieces of our state code into alignment with the federal protections.
So they could either be charged more or denied outright coverage. Okay, and insurers would no longer have to insure children up to the age of 26 on their parent or guardian's policies.
That's right. In our state law, we have it to 25, but we have no parallel provision for youth aging out of foster care to maintain their Medicaid coverage. And of course, the ERISA plans, which you guys have talked about today. You know, without the ACA, there's no way that people with the large employer coverage can get that same protection for their kids.
And we had heard a lot of testimony earlier this morning on a separate measure with respect to mandatory coverage of certain screening procedures. And one that was discussed was mammography. And that's one of the guaranteed no cost to the patient benefits under the Affordable Care Act. Is that right? One of several.
That's right. Immunizations, contraception, mammography, all sorts of cancer screenings that patients can get today at no cost, no copay at the point of service. And that would go away. We don't have those protections in state law.
So if the lower court or the district court's ruling is upheld, ultimately, those guaranteed protections would cease to exist for Texans, unless the legislature passes this bill to codify those protections in state law.
That's right. Putting them in state law can make sure they apply to all state regulated plans.
Okay. Thank you very much.
Thank you.
Members, are there any questions? Dr. Albertson?
Yes, sir.
Stacey, I appreciate your testimony. Okay, so I just want to make sure I understood what you said. So you're saying if the lawsuit is successful but if this bill passes, that ERISA plans will be subject to the terms of the bill we pass here at the state level?
No, I'm sorry if I was unclear. We can't, and you can't, and I share your frustration often that you can't from that dais pass consumer protections that apply to ERISA plans. If a lawsuit invalidated the entire ACA, we would
those are gone,
need Congress
right?
to act.
Yeah, those are gone at that point. Okay, so specific to this bill then, what portions of the marketplace are we touching with the protections that you're envisioning? I mean, obviously the commercial space, is that?
Right, the commercial plans, and you'll hear further testimony on the Medicaid space, but the commercial plans are what I'm talking about. No lifetime limits, no pre-existing condition discrimination. So job-based insurance that's fully funded or state regulated is what would be touched by this law. And of course, there's the piece that I talked about where youth aging out of foster care who have Medicaid today could maintain their Medicaid coverage.
Okay. All right, I appreciate it. Thank you so much.
Of course.